What does the abbreviation NPO stand for? A. Nothing pureed only. B. Not prepared on site. C. Nothing by mouth. D. Nothing by order. Answer: C. Nothing by mouth. The artificial opening in the abdomen for an ostomy is called A. Stoma. B. Stool. C. Bag. D. Anus. Answer: A. Stoma. To convert ounces to milliliters, multiply by A. 15. B. 20. C. 60. D. 30. Answer: D. 30. When providing perineal care for a female resident, the nursing assistant should A. Wipe from front to back. B. Wipe from back to front. C. Wipe the anal area first. D. Use the same area of the washcloth for each stroke. Answer: A. Wipe from front to back. According to the USDA's My Plate icon, which food groups should make up at least half of a person's plate? A. Grains and proteins. B. Vegetables and fruits. C. Dairy and proteins. D. Grains and fruits. Answer: B. Vegetables and fruits. The first sign of skin breakdown is A. Muscle damage. B. Blackened skin with pressure ulcers. C. Shallow crater. D. Pale, white, reddened, or purple skin. Answer: D. Pale, white, reddened, or purple skin. At which angle should residents be positioned for eating? A. 180 degrees. B. 120 degrees. C. 90 degrees. D. 100 degrees. Answer: C. 90 degrees. Which of the following blood pressure readings falls within the normal range? A. 119 out of 75. B. 135 out of 90. C. 91 of 70. D. 140 of 80. Answer: A. 119 out of 75. A is used for residents who cannot assist with raising their hips onto a bedpan. A. Portable commode. B. Urinal. C. Fracture pan. D. Bedpan. Answer: C. Fracture pan. A. Stocking is a special stocking that can help with circulation. A. Shear. B. Clotting. C. Rotating. D. Antiembolic. Answer: D. Antiembolic. A urine specimen can be collected anytime the resident voids A. Routine. B. Clean catch. C. 24-hour. D. Sterile. Answer: A. Routine. The most common site to take the pulse is the A. Brachial pulse. B. Radial pulse. C. Carotid pulse. D. Pedal pulse. Answer: B. Radial pulse. How many feet does a quad cane have? A. 1. B. 2. C. 3. D. 4. Answer: D. 4. The process of breathing in and out is called A. Inspiration. B. Respiration. C. Expiration. D. Expansion. Answer: B. Respiration. Residents with COPD have trouble with A. Breathing. B. Urination. C. Losing weight. D. Vision. Answer: A. Breathing. When a resident uses a cane, walker, or crutches, the nursing assistant should A. Stay on the resident's stronger side. B. Stay on the resident's weaker side. C. Walk in front of the resident. D. Walk behind the resident. Answer: B. Stay on the resident's weaker side. Signs and symptoms of clinical depression include A. Intense hunger. B. Breath that smells fruity. C. Intense, sudden chest pain. D. Apathy. Answer D. Apathy. The best time to collect a sputum specimen is A. Early in the morning. B. After the resident has eaten a meal. C. Right before bedtime. D. Right before lunch. Answer A. Early in the morning. Weakening, wasting away, and decrease in size of a muscle is called A. Dystrophy. B. Atrophy. C. Contracture. D. Dislocation. Answer B. Atrophy. Which is the last sense to leave a person? A. Sight. B. Touch. C. Hearing. D. Smell. Answer C. Hearing. After a total hip replacement, the hip cannot be bent or flexed more than degrees. A. 45. B. 75. C. 90. D. 100. Answer C. 90. Which of the following is a care guideline for residents recovering from a CVA? A. Assist with ambulation to prevent falls. B. Encourage resident to finish tasks as quickly as possible to help speed recovery. C. Do as much as possible for the resident so that care can be completed more efficiently. D. Place food in the affected/weaker side of the mouth when feeding. Answer A. Assist with ambulation to prevent falls. A tumor that is cancerous is called an tumor. A. Opportunistic. B. Malignant. C. Benign. D. Metastasized. Answer B. Malignant. Which of the following statements is true of Alzheimer's disease, AD? A. Skills a person has used over a lifetime are usually kept longer. B. Residents with AD will show the same signs at the same times. C. NAs should do everything for residents with AD. D. Alzheimer's disease is a normal part of aging. Answer A. Skills a person has used over a lifetime are usually kept longer. Which of the following is a guideline for safe diabetic foot care? A. Clip residents' toenails frequently. B. Inspect and clean residents' feet every day. C. Use lotion between the toes to prevent dryness and cracking. D. Use hot water for bathing the feet to help prevent infection. Answer B. Inspect and clean residents' feet every day. If a resident with Alzheimer's disease has problems with bathing, the nursing assistant should A. Surprise the resident with the bath. B. Hurry the resident through the bath. C. Insist that the resident bathe even if she does not want to. D. Schedule bathing when the resident is least agitated. Answer D. Schedule bathing when the resident is least agitated. A diabetic resident should A. Skip meals. B. Go barefoot. C. Receive careful foot care. D. Avoid exercise. Answer C. Receive careful foot care. HIV can be transmitted A. To a nursing assistant who touches an infected resident's telephone. B. To anyone who uses the same toilet as an infected person. C. To people who hug an infected person when that person has a fever. D. To a fetus by an infected mother. Answer D. To a fetus by an infected mother. Which of the following thermometers is used to take a temperature from the ear? A. Oral thermometer. B. Rectal thermometer. C. Tympanic thermometer. D. Axillary thermometer. Answer C. Tympanic thermometer. Which of the following statements is true of HIV and AIDS? A. AIDS can be cured. B. Having unprotected sex puts a person at a high risk for HIV/AIDS. C. Standard precautions do not need to be practiced on a person with AIDS. D. A person with HIV can be fired because of the disease. Answer, B. Having unprotected sex puts a person at a high risk for HIV/AIDS. Alternate communication methods for a resident with an artificial airway include A. Playing charades. B. Shouting at the resident. C. Asking the resident's family what they think he wants. D. Using communication boards. Answer, D. Using communication boards. When assisting with ROM exercises, the nursing assistant should begin at the end, work her way the body. A. Abdomen, up. B. Feet, up. C. Head, down. D. Thighs, down. Answer, C. Head, down. How should residents be positioned while they eat? A. Lying flat on their backs. B. Reclining at a 45-degree angle. C. Sitting as upright as possible. D. Lying on their sides. Answer, C. Sitting as upright as possible. One way for a nursing assistant to help a resident with Alzheimer's disease with eating is to A. Put a few types of food on the plate at the same time. B. Use dishes without a pattern and a simple place setting. C. Withhold food until the resident is really hungry. D. Serve steaming hot foods and drinks. Answer, B. Use dishes without a pattern and a simple place setting. Orthotic devices are used to A. Keep joints in correct position and improve function. B. Assist residents with ADLs. C. Maintain proper body alignment. D. Prevent rubbing, irritation, and pressure ulcers. Answer, A. Keep joints in correct position and improve function. When should documentation be recorded? A. Whenever there is time. B. At the end of the shift. C. Immediately after care is given. D. Before the care is given. Answer, C. Immediately after care is given. An object can be called clean if A. It has not been used on or near a sick resident. B. No dirt or debris is visible on the object. C. It has been contaminated with pathogens. D. It has not been contaminated with pathogens. Answer, D. It has not been contaminated with pathogens. In which of the following parts of the body are mucous membranes found? A. Feet. B. Hands. C. Genitals. D. Elbows. Answer, C. Genitals. Problems affecting nutritional intake among the elderly and chronically ill include A. Fatigue and pain that occur with certain illnesses increase appetite. B. Older people produce more saliva. C. Increase in physical activity and mobility causes an increased appetite. D. Ability to smell and taste food and drink decreases as people age. Answer, D. Ability to smell and taste food and drink decreases as people age. The chain of command is A. A legal term meaning a person can be held responsible for harming someone else. B. The line of authority in a facility. C. The person in charge of the department for each shift. D. The department that a nursing assistant goes to if he wants to report a problem. Answer, B. The line of authority in a facility. Which of the following is an ombudsman's responsibility? A. Helping with care procedures. B. Assisting with resolving facility budget problems. C. Investigating and resolving complaints. D. Creating special diets for residents. Answer, C. Investigating and resolving complaints. A resident has purchased a special gift for her nursing assistant, Sarah. Which of the following would be the best response by Sarah? A. Refuse but thank her for thinking of her. B. Accept because Sarah does not know her facility's policy on gifts. C. Accept and ask the resident not to tell anyone. D. Refuse and tell her that her employer is very unfair about employees accepting gifts from residents. Answer, A. Refuse but thank her for thinking of her. Which member of the care team assesses residents, monitors progress, and gives treatments? A. The nursing assistant. B. The nurse. C. The medical social worker. D. The registered dietitian. Answer: B. The nurse. Hand hygiene is A. Washing hands with soap and water only. B. Using alcohol-based hand rubs only. C. Wearing gloves when performing care procedures. D. Washing hands with either plain or antiseptic soap and water or using alcohol-based hand rubs. Answer: D. Washing hands with either plain or antiseptic soap and water or using alcohol-based hand rubs. A nursing assistant should reposition bedbound residents at least every A. 2 hours. B. 3 hours. C. 10 minutes. D. 20 minutes. Answer: A. 2 hours. Which of the following statements is an example of a fact? A. Mrs. Christensen seems happy when we serve meatloaf. B. Mrs. Christensen is too thin. C. Mrs. Christensen weighs 142 pounds. D. Mrs. Christensen is lonely. Answer: C. Mrs. Christensen weighs 142 pounds. How should a standard bedpan be positioned? A. The smaller end should be aligned with the resident's buttocks. B. The wider end should be aligned with the resident's buttocks. C. One of the longer sides should be aligned with the resident's buttocks. D. It should be turned on its side. Answer: B. The wider end should be aligned with the resident's buttocks. Which of the following statements is true of spiritual needs? A. Residents will believe in God. B. Residents will be Christians. C. Residents will have different spiritual needs and beliefs. D. Residents will not believe in God or a higher power. Answer: C. Residents will have different spiritual needs and beliefs. Where should the call light be placed when a nursing assistant leaves a resident's room? A. Within the resident's reach. B. Next to the television remote. C. On the bedside table beside the telephone. D. On a chair next to the resident's bed. Answer: A. Within the resident's reach. Blood pressure is measured using A. Thermometer. B. Watch. C. Finger. D. Sphygmomanometer. Answer: D. Sphygmomanometer.